Good afternoon and welcome to A Connected Community, a Facebook Live streaming to you here from Beach House Center for Recovery in Juno Beach. I am Micah Robbins. I will be hosting this conversation today. And today we have a very special guest, our friend Dr. Nicole Rothman from the Veterans Administration Hospital right here in West Palm Beach. Off Riviera. Where exactly are we located, Dr. Rothman?
So we are in West Palm Beach. We're at the corner of Blue Heron and Military Trail.
It's that giant building you see coming
Big
down
pink building, yes.
And lots of amazing things are happening there. This conversation today is actually so we can talk about our friends, family, relatives, the amazing people that serve our country every day and give so much and sacrifice so much. And in the world of substance use and substance use disorders, this is a population that is affected greatly, more greatly so than our population in general. So today's conversation, we're going to look at some of those issues. We're going to look at how we can be supportive, and we're going to do what we can to help those that serve so proudly. So Dr. Rothman, we have some questions here, and we'll have a conversation about it.
Great.
So the VA is a critical part of the community. And substance use disorders are certainly among a rising issue in our men and women in service. What are you seeing are some of the trends that are happening right now, and what is the VA's response at this moment?
So I'd say the biggest trend right now is an increase in heroin overdoses and use of opiates. And that, I feel, is a crisis within the country and within our community. A lot of accidental overdoses, mixing different types of opiates and not knowing what they're taking. And so the VA has been responding by offering kits that can help family and friends help somebody who may be overdosing. Naloxone kits, they're called. And we give them to the veterans, we can give them to the friends and family of the veterans, and then we give education about how to use the kits, and that can really save somebody's life in that moment where they may be overdosing. And so we are working very hard to get those to as many veterans as we can, and offering them in our inpatient detox unit, offering them in our outpatient substance abuse program. We've been providing education throughout the VA and in the community about how important it is to give these as quickly as possible to try and save lives.
And have you seen an increase in the overall population of veterans in need of this? Or I should ask, let me rephrase that. How many veterans are you aware of that need services like this, especially in the South Florida region?
It's hard to put a number on that just because of varying degrees of how many will ask for help or say that they're suffering with this type of issue. So it's hard to put an exact number, but we are seeing an increase. I feel the younger veterans are struggling with opioid issues, and that they're getting them from, as a prescription. A lot of times they'll start off like that, they become addicted, and then, they need assistance coming off of the painkillers. So a lot of times if they can't get the painkillers anymore, they'll start using heroin or they'll start using them off the street. So I have seen an increasing amongst the younger veterans, an increasing trend. And we hypothesize that maybe it's because, over in the Middle East where our veterans are in these situations, they have more access to painkillers, they're injured, so they're getting the painkillers. So when they come back over here, a lot of times they come back over addicted. So it's, that's kind of what we're seeing.
And I was doing some research with the VA, and it seemed to be that there was, because of the improvements in battlefield medicine, you're having a survivability rate that is much greater than in previous conflicts. And that's just been steadily improving. I mean, that's one of the horrible parts of war, but these traumatic injuries that used to be life-ending, there's a lot of life-saving that is happening.
Yes.
Do you think that might be part of the increase in overall need? Because once you have those injuries, usually there has to be some sort of pain management that goes with that.
Definitely. Yeah, absolutely. And then, over there when they're, still in a combat zone or they want, they want to still participate and do their job and serve. So they will take those medications and continue going. And so, yes, then they are, surviving more and having more injuries. They're fighting with injuries. And these are some of the aspects that get them addicted.
And along the lines of that, because of the mental stress of the battlefield situation, and we know PTSD is certainly a widespread challenge in our veteran community, are you seeing a lot of co-occurring issues with PTSD and substance use disorders?
Yes, and that is a very common, two issues that go together frequently, and we are seeing a lot of veterans coming back with PTSD, major depression, and so we've been working to offer different types of treatments within our program that focus on post-traumatic stress disorder and depression, family conflict, family issues. So yes, we adjust our treatment in order to meet the needs of the veterans, and PTSD is a very common issue that they're coming back with.
And what are some of the treatment modalities that you're finding to be very effective within the Veterans Administration?
So we use a lot of evidence-based treatment for post-traumatic stress and substance use disorders. Seeking safety is one of the treatments that we use, which really focuses on coping skills, and it's a time-limited group that we offer. The coping skills are specific for PTSD and substance use. We also offer dual diagnosis groups with that same focus on post-traumatic stress as well as.
So the evidence-based is a big word, if you will. It's a big catchphrase right now in our, especially our treatment world, because there's a lot of folks that are just now understanding sort of the breadth, width, and impact of the opiate epidemic in particular, but certainly substance use disorder in general. And could you explain a little bit for those that may not be as understanding, why evidence-based programs and what does that mean?
So what that means is it means that the treatments have been studied and there is a lot of research backing the effectiveness of those types of treatments. And so the VA wants to use the treatments that are shown to be the most effective in helping veterans cope, use, and also maintain their sobriety. So it's really targeted to show the effectiveness by the research, and those are the ones that we want to be using.
And with that in mind, because you're showing effectiveness, you're also going to show an improvement in outcomes. What are some of the outcomes that you've been observing as you've been going through this process?
So what we see is as the veterans are progressing through the program and applying the skills that they're being taught, they're maintaining sobriety, they're avoiding situations that might put them at risk for drinking or using drugs, and they're developing a support system around them in the community and within the VA, which also helps them deal with these tough situations. They are coping better with their anxiety, depression, they're improving their sleep, their eating habits and diet improves, and their overall mental health starts to improve. And they also start to improve their confidence, and they improve their relationships, decision-making, the choices that they make. And so it can really have a significant impact on their day-to-day functioning.
And do you have the ability to track outcomes? What are some of the methods you use to track these outcomes?
So the most common method that we use is we'll do a chart review and kind of follow along where a veteran, from start to where they are now. We have a lot of, we offer treatment plans that are reviewed with the veteran periodically. So anytime there's a change in their treatment, or if they're making, a significant amount of progress, we'll review their goals. And that is also another way that shows how well they're doing, or some areas that maybe they need to focus on if they're still struggling. And so those are some of the outcomes that we use.
And are you finding it to be more effective because you have, shall we say, a captive audience? When they're, you have a system in place they can access, they can follow up with. Are you finding that to be an effective environment, as opposed to, say, just a public infrastructure, a public health domain?
Yes, I feel that one of the reasons why we're successful is that we really approach it from a multidisciplinary team. So we have psychiatrists, psychologists, social workers, case managers, addiction therapists, peer support. We have a lot of different perspectives and different disciplines to kind of attack the problem and approach the veteran, from where they're at. And so we have a lot of resources available to us. We work with other departments within the VA. So if a veteran with a substance use issue, then we can reach out to social work and obtain housing for that veteran. And so if there's a legal issue, let's say they've had a history of a DUI or a possession charge, we have a Veterans Justice Outreach program that we work closely with. And so we system here where there's so many resources to help the veteran in whatever area they may be struggling with.
So with this abundance of resources, how are you able to get veterans into the program? How do you outreach and get them into the program?
So we have a lot of different sources of that. Veterans can come in through the emergency room if they're in need of detox, and we have providers there that will start to educate them about the services that we offer. We have, they can come in through primary care. If they let their primary care doctor know, let's say they're drinking too much and they need help. We have providers embedded in primary care that can also refer them and provide education into what we offer. We do community outreach. I'm part of the Treasure Coast Opioid Task Force, where we, meet with community partners, police force, other treatment programs, halfway houses, transitional houses, and residential programs. And we really work closely together to provide services in the community. And so we really try to, there's no place where they're turned away. There's no wrong door. So they can come in a lot of different ways, and we work really hard to get them into our program.
Now, you have an extensive network and extensive resources. And first, I must say that you have an open invitation to our opiate task force here in Palm Beach County, too. So, open door.
Great, that would be
anytime.
Great.
The other component, though, is that, people, and today, just today itself, we had an article in the New York Times talking about some of the challenges and certainly some of the issues within the treatment community, not only here in South Florida, but also across the country. You show success in your program. There's other programs that show tremendous amount of success as well. Do you ever interact with the treatment community, the private treatment community, or other public treatment infrastructure here in South Florida, either to increase capacity or to offer aftercare programs or continued level of care when maybe there's a gap of resources? Is that a network that you work with?
Yes. So we have a lot of resources in the community that we work with. We don't have our own residential program within the VA hospital itself. So we have developed really strong relationships with residential programs in the community where we send our veterans for residential treatment. And we've had a lot of success in providing that type of treatment in the community. And we also network with other partners in the community. If there is some type of gap, if there's something where a veteran, let's say, lives in a northern county and is having a really hard time getting transportation to the VA, then we will try to fill in a gap with one of our community partners providing an intensive outpatient program or some other type of service that we may not offer.
And when you have, again, we're talking about a very unique set of very special people in our country. Are there any precursors or certain stimulus that are unique to this population? Are these things, and what are some of these things you observe that may be a precursor or an indicator that someone could have opiate use disorder?
So there are certain things I think that are in general related to substance abuse. A lot of times there is a genetic component. If their entire family has become, has addiction run through the family, there can be a genetic predisposition. There are also a lot of environmental factors. We see a lot of veterans that come with a childhood history of abuse or neglect. And so those are some of the issues that may impact somebody with a substance use disorder in general. And then there are factors that are unique to veterans, such as being in combat or veterans that suffer from military sexual abuse, where they are assaulted or abused or harassed while they are in the military. And that can also create a very, very difficult way of dealing with that. A lot of times they will develop depression from those experiences. And so I think it can be a combination of, things that are specific for veterans and then issues that are common with any type of addiction.
And you mentioned certainly with the widespread unveiling, if you will, of a lot of harassment, sexual harassment issues, and it's a story a day right now. Have you seen an uptick in those seeking services? You mentioned people, but have you seen an increase in that because of this environment now where people are starting to feel safer and more comfortable, or just having the ability to take that risk and come forward with those situations? Are you seeing an increase in the need for your services because of that?
Yes, and we do see an increase because I feel it's creating a little bit more of a safe environment for veterans to come forward and to share that they have been sexually assaulted or harassed in the military. And so we offer a lot. We have an entire military sexual trauma program. It's a specialized rotation within the VA of providers who have been trained specifically to deal with this type of trauma. And we have a military sexual trauma coordinator who puts on events. We have a lot of events within the VA and in the community to educate people about this issue. And so I think that what I'm hoping is the good part of this coming out more in the news is that it opens the door for people to seek help and to let go of that shame or that stigma that they may carry, to know that it's okay to admit that they're a survivor. And so I think it may not be an actual increase in numbers, but it is an increase of people being able to ask for help and share that with somebody.
And that also leads to veterans in general too, about breaking down some of those barriers and walls that, for so long, maybe veterans haven't asked for help, certainly with substance use disorders, but also with this increase in other issues as well. How do we break down some of those barriers? What are you finding to be effective for you at the VA that's breaking down some of those barriers for veterans that haven't spoken up for so long?
Sure. Yeah, I mean, it's really, we work really hard to reduce the stigma as much as possible. So a lot of times the first step is just normalizing, making it seem normal how difficult it is to talk about and share that with somebody. And we really do our best to put ourselves in their shoes and be supportive and really praise them a ton for coming forward. And I always have I find that a lot of veterans feel that talking about these issues or showing emotion about them, maybe crying, is a sign of weakness. So sometimes you have to gently challenge that idea and show them that really it takes a lot of courage and strength to do something this difficult. And so just really letting them know that it's okay, that we're not here to judge, we're here to help them, and to really try to understand what they went through, and to really give them a lot of positive feedback about how important it is to start the process of healing and talking about it, as difficult as it is. And that we really do our best to try to get through to them that this is a big step, really going to help them in the long run to be more open about it.
And we talk about the military being a family and certainly breaking down those walls, but we know that addiction certainly is a family disease. It's a family issue. What supports do you have for families, parents, spouses, children with the VA that people can access?
So we offer the family to be involved in the veterans treatment. We really encourage that from the veterans, directly with the veterans, and then if we can speak with the families to get them as involved in treatment as possible. I find that it's really important to educate the families. A lot of times that parental instinct is to help the veteran who has the addiction. Sometimes that can sort of spill over into enabling, and it can kind of make the situation worse at times. So we really want to educate the families about ways of really helping the veteran get better. And sometimes that may involve having a consequence, a financial consequence, for example. And so we want to educate the families in what's the best way to get that person into recovery, into sobriety. And so a lot of times we will refer to Al-Anon in the community. I find it's important for the families themselves to have their own support in dealing with the addiction and the impact of that. So helping each other and really coming together, because it's very challenging to deal with also for the families. And a lot of times the families themselves have been through a lot. And so it's helpful for them, we'll suggest having the families have their own therapist or source of support that they need in order to, heal from all this. So it's a crucial part. There's really, no one can do it alone. So the families are a big part of that.
And it seems
so we really try to involve them as much as possible.
And it seems to be quite a 1-2 punch. You're working through just the challenges of a returning veteran and all the experiences they had, and then at the same time, working on with the next challenge, which could be not only either things that have happened mental health wise, but physically, and certainly that could lead to substance use disorder. So, I mean, I think that you certainly have your work cut out for you. And is there a specific office or separate family counseling center that's run by the VA, or is this something you do just community-wide?
We do this community-wide within our program. We don't have specific groups for the family members, but we will involve them in the veterans' individual therapy and medication appointments. A lot of times we will refer them to the vet center where they will have specific family counseling. And we do offer couples counseling within our mental health clinic, and we can refer our patients there as well, where we have providers that are specifically trained in couples and therapy and marital counseling. So those are some of the resources that we use.
And there's another very tragic side effect to all this too. One of the statistics that keeps going up is the rate of suicide among our veterans and returning veterans. What are some of the strategies that you're working on now to address this occurring issue, if you will, along with the rise of substance use disorders, we have a rise in suicides? What are some of these strategies that you're utilizing right now?
So suicide prevention is one of the VA's top priorities. And so the VA has been implementing a lot of different strategies to reach out to the veterans, to make sure the veterans know that they are cared about, they are not forgotten. And so we have a suicide prevention coordinating team within our VA, and they do a lot of outreach to educate the community about identifying signs of somebody who may be suicidal. We have the providers at the VA and within primary care are also trained to assess and risk factors and protective factors, which are factors that may help us identify somebody who is thinking about harming themselves. And so we offer a lot of resources. We have a program called the Reach Vet, where we have providers that are making phone calls and reaching out to veterans that may be at risk for suicide. And so we are really doing the best that we can to prevent it as much as possible. It is integrated into almost every type of therapy and treatment that we offer within the VA.
And are there, it's such a, it's a painful issue. Are there any specific program, you mentioned some wonderful outreach programs. Are there any other modalities or specific strategies that those out in the community can maybe access or support if we see veterans in our community or our own family members or our friends that maybe we have curiosity or risk that's happening there?
Sure. Yeah. I mean, it's a difficult topic, and I think to learn about the different signs and symptoms, a lot of times there are certain things that a person may be doing that might be a sign that they're thinking about suicide. Sometimes people think that if they talk about suicide, they're going to make somebody think of it. And that's actually a myth. The more that you can talk about it with somebody, the less likely they are to commit suicide. Other signs are, things that somebody is really isolating. They're not reaching out to anybody. They're sort of shutting down. That would be another sign. Giving possessions away all of a sudden. So those are some of the things that, somebody could identify, and really approaching the person and talking about them, encouraging them to get help in a non-judgmental way is one of those ways of trying to get through to that person and seeing if they'd be willing to get some help.
Can a civilian reach out to the VA if they feel a family member or loved one's in danger of either certainly a suicide risk, but also if there is a suspicion or that we know that there's a substance use disorder?
Absolutely, definitely, yes. They can call any provider. Even our frontline clerks are trained if they get a phone call of somebody who, a family member, a friend, or somebody who may be in crisis. They are trained specifically to get a provider to handle those situations. So yes, we want that family member or friend to be reaching out to us and letting us know about those situations. If we find that we can't get a hold of a veteran or a family member or a next of kin, we will send the police to do a health and welfare check on that person just to see if they're okay. And a lot of times, they end up being asleep or they didn't realize they had an appointment. But if we're showing them that we care about them and we want to make sure they're okay, so we will go to any lengths in order to do that because we want to make sure they're safe.
And for our veterans here in Palm Beach County, certainly they can access the VA physically. How wide, because there's VA facilities across the state of Florida, but how wide is the service area for this particular facility?
So we go all the way up into the northern counties. We have what are called community-based outreach centers, or CBOCs for short. And we have them in Vero Beach, Fort Pierce, Stewart. We have telephone connectivity to Okeechobee. We have a CBOC in Delray and Boca. And so we really have a wide range of a big area that we try to cover as best as possible.
Well, it sounds coincidental and very good that we have the opportunity to have the same sort of service area. Our managing entity and certainly a lot of the resources we share here in the Palm Beach County, it does share north with the Treasure Coast, the 4 counties to the north. So that district itself certainly has the opportunity for some real great collaboration. And it sounds like, and certainly from my knowledge and my observations and inclusion, that the VA is a very welcome and willing community partner. And are you seeing any barriers to that, or are you seeing maybe some new opportunities where the VA can be even seen as a leader in this field, especially as we're dealing with this epidemic here in South Florida?
I'm really hoping that we're seen as a leader, and we welcome opportunities to work with the community. I haven't really come up with any barriers that we see. We really do work really hard. We hold a mental health summit where we invite partners from the community to come into the VA and learn about everything that we offer, and we want to learn about them as well. I think it's best if we have strong relationships with the community, and obviously we can't be everywhere all at once. So it's really, really important that we have strong relationships with our partners in the community so that we can work together. I mean, this is a challenging field, and there's a lot of difficult parts of doing this type of job. So I think that the more we can approach it as a team and as a community, the better.
I can't agree more. Dr. Rothman, we have from one of our fine viewers out there in Facebook land, we have a question, so I'm going to pull it up here. Hold on just one second.
Okay, great.
I like this one. This is a great question. We get this a lot. What can civilians do to support their local VA hospital?
So there are a lot of things that they can do, and just getting involved, finding out kind of what we offer to the veterans. We have a lot of events in the community. Come join us in those events, participate. We have volunteers throughout the hospital, and civilians can come and volunteer in a number of capacities. And we have a lot of different events and things like that they can be a part of. So, there's a lot of ways to get involved with veterans, and so those are just some of the things. And
I know that the facility right now, you say you don't have a residential facility. There's been a rumor that the VA is finally going to have an opportunity to open their own facility here soon?
Well, what we are getting is we're in the process of building a domiciliary, and that is going to be for homeless veterans. We're going to have beds for women. We're going to have beds specifically for substance use. And so we'll be providing a residential environment for them on our campus. And so that will also, in addition to having services there, they're also going to be offered services within the main facility as well. So that we're hoping to get that set up soon, within the next year.
And will that be accessible for veterans from the entire Florida region, or will this be just in the service area of the VA here in Palm Beach?
It'll be mainly in this area, but we also have partnerships with other VAs in Florida. And so if there is an emergent situation or something that they, really aren't able to handle, we do, work closely with our sister VAs.
And you also mentioned this will be for homeless, indigent, certainly multiple populations of our veterans. Speaking of our homeless veteran population, which again is tragic in itself, what are some of the resources that are available to those that are indigent, find themselves indigent, or their outreach services to reach out to our homeless vets?
So we have a lot of services that we offer. We have transitional housing where the veterans can come into one of the houses that work very closely with the VA. They have the opportunity to participate in our intensive outpatient substance abuse program. They can live in those places depending on their own situation. It could be anywhere from 6 months up to 2 years. And as part of those programs, we also offer them vocational rehab to try to get them employed and working again. And ultimately, the goal is to get them back into independent housing. And so we'll offer them these resources so that they can get financially stable again. We offer the Veterans Resource Center, or the VRC for short. And these are programs that can work on getting them housed quickly. We have a program called HUD-VASH, which offers them HUD vouchers, and those are helps them with their expenses and gets them off the streets, and they will get into their own apartments. So we have partnerships, so we work with the landlords and the apartment complexes around in Palm Beach County to get them rapidly housed as quickly as possible.
And Dr. Rothman, you're explaining a full system of care through the VA for our veterans. As you observe and certainly sit on some of the task forces around in the community, what do you observe that's happening, or let me rephrase that. Where do you see a system of care approach that the VA has being effective for the community at large? Are you seeing certain areas that have challenges to creating that system, or are you seeing areas where maybe that's starting to work? Because certainly in a governmental agency, and certainly with the military, mission-driven, solution-focused, and system-wide care is very important. We have a system in South Florida that isn't working for everybody right now. Where do you see this, maybe, again, when I talk about leadership of the VA, where can you see some of that applying into our public sector down here in South Florida?
So I think what we're trying to do is work on improving our collaborations with other agencies. So for example, on the opioid task force I mentioned earlier, one of the ways that we're working on helping the community is to offer treatment instead of punitive measures like getting arrested. So we've been working with the police to, if a veteran or a civilian comes to the police, sort of turns themselves in, instead of getting arrested for drug possession or something like that, the police are going to provide them with a list of treatment options from the community and try to get them involved in treatment versus arresting them and putting them in jail. So these are some of the collaborations that are going on between, the treatment aspect of things and the police service and other agencies that may be involved to try and get that person help versus, just having them sit in jail. So we've been working very closely with our Veterans Justice Outreach Program to help veterans get the treatment that they need versus, taking a more punitive approach.
And as a professional in this field, and certainly a leader in this field, where do you see this going? We are in the midst of probably the worst epidemic in a substance use issue, I know in my almost 25 years of prevention that I've ever seen. The statistics are there. And people actually make reference to the opiate issue as this generation's Vietnam. Certainly not in the issue or the challenges that our soldiers faced in that conflict, but in sheer number. Last year we surpassed in 1 year the entire death toll of the Vietnam conflict. Where do you see this going?
So, it is a very challenging issue to deal with, and I think that having the collaborations like, things like what we're doing today and other types of partnerships are so important because, like I said earlier, you can't do it alone. And I've never met, somebody who is struggling with an addiction get sober or get better by themselves. And so we really have to tackle the problem, together with.
We hear you. We may have just lost our. Sorry, Darla. We may have lost our audio for just a second, but I think we're back. We're back now. And the path forward is going to be. We're kind of in uncharted territory as far as some of the substances we're seeing. Certainly with the abundance of overdoses and deaths, and right now we're not seeing any abatement of that. So again, we appreciate what you're doing there. We have another question that's coming in from our friends out in Facebook land.
Okay.
And it's on its way. This is the part where high tech meets low tech because I can't see it right in a small screen. So, oh boy, this is good too. Any suggestions or strategies of how to help ease into a supportive community for a veteran who might be reticent to ask for help? So again, going back to that resistance of a veteran in need. So some ways that maybe we can find a supportive environment for them.
Sure. So one of the treatments that we offer is called motivational enhancement therapy, and it sort of takes a different type of approach to veterans that may be reluctant to change, or there may still be some denial. And so what it offers is a different way of looking at the alcohol or drug use to see really if that person feels that it is a problem. I think sometimes the older ways of dealing with it would be to confront the person and challenge them and try to break down that wall in a challenging kind of way or a confrontational kind of way. And that really doesn't work for a lot of people. And so what this offers is a different non-confrontational way to have the veteran really look at it themselves and determine, hey, have you ever thought about this in a certain way? Like, have you ever thought about the money that you're spending and what other things could that money be used for? Have you ever thought about, the risk factors or some of the consequences that you may be suffering because of this? And to approach it in a different way And like you said, I think it is uncharted territory with some of these synthetic drugs and things that we're seeing these days. And so we have to be able to be flexible in the approach that we use. So sometimes, handling it one way isn't really going to get through that reluctance or that fear that might be there. So we kind of have to approach it in a different way and change gears in a sense to try to meet the person where they're at. And not everybody is ready to accept help right away, but that doesn't mean that they can't get there.
And it sounds like a way to really value the individual and value the person in front of you. Non-confrontational and really a person-first approach. And you mentioned it's an MET strategy, and it kind of leads me, just because of the acronym, but certainly MAT, medication-assisted treatment. It's a big buzzword out in the community, certainly in the media, and in the treatment field. Where's the Veterans Administration stance or practice in utilizing medication-assisted treatment regimens?
So what we're doing is that we are offering a lot of different types of medication. Same as the community, we stay on the cutting edge of the research. So we're offering medications like Suboxone and naltrexone, acamprosate, Vivitrol. So these are what the research is showing are helping the veterans deal with cravings, helping to prevent relapse. And so these are some of the medications that we offer to stay on top of that.
And although it's always case by case, is there a recommendation out of the VA as far as how long or how intense the buprenorphine regimen should be, or time frame?
It really does depend on the person. However, what we find is that we will start them off with a trial, and if they do struggle, sometimes we will have them come in once a week. So if they need a little bit more support, if they're really having a hard time sticking with the protocol or avoiding relapse, we'll adjust it based on what they need. And if they are doing really well with it, and then we might see them once a month if they don't need any more than that. So we can be really flexible just depending on where they're at and what they need.
And you also mentioned earlier you're seeing a rise in the number of young veterans coming in. Are you seeing any other challenges? Obviously, we have veterans from many, many conflicts that utilize the VA. Are there any other population groups or age groups, demographic groups that you're seeing either an increase or more of a challenge with substance use disorders right now?
I would say that one of our bigger challenges would be the Vietnam veteran population, because unfortunately the VA was very different back then, and the country was different in their approach to war, and so they were treated terribly when they came back into the country, and so they did not seek help for some of them for decades. And so the problem has become very ingrained in their routine, in their mental health issues. And so for a long time, they would view the VA as a place they wanted to avoid. They didn't want a reminder of Vietnam or of the war, and so they would avoid. And so I think that that's one of our challenges, is to really try to show them how much the VA has improved, how much we've changed, and so we involve them in treatment and get them into the VA as much as possible. But it's really tough when something, their addiction may have been around for 30 or 40 years before they even, sought treatment for the first time. So that does tend to be challenging, but we do the best that we can to really reach out to them, and we want to show them how much the VA has improved.
And I could speak from personal experience, and I'll credit my relationship with the VA here and seeing how everything works, that I encouraged my own father, he served proudly in Vietnam and hadn't even considered accessing VA services. And certainly he's an older gentleman now in retirement, and it was for a different issue, because we just thought he had, selective hearing. No, he was having some serious challenges, and that was brought on by certainly that experience there. And he found is that there's challenges certainly, but that he found it to be inviting, welcoming, and he actually felt after almost 50 years that level of care.
Wow.
So I'll thank you for him.
Yes, no, that's great. That makes me very happy to hear that. Yeah, and we want more of those types of experiences, definitely.
And so as we start wrapping up here, I know this kind of flies by. You're such a resource, Dr. Rothman. I can't thank you enough. But let's talk about our community a little bit more. Where does the community need to be for our veterans? And this topic comes up over and over again, but people are always asking, where does the community need to be for our veterans?
I think the best way that the community can serve the veterans is to get that education, to learn more about addiction, to learn about recovery and what it involves. Get involved as much as you can, and even if it's a little bit, a lot, whatever you can do, and really just if you know a veteran, let them know that you're here for them, as to be as non-judgmental as possible, to really listen and listen to their story and listen to what they need, and also kind of reducing that stigma that it's okay to ask for help, it's okay to talk about these problems. We really want to encourage that it takes strength, that it's not a weakness, and to really learn about the different ways of helping a veteran who has an addiction the best that they can. Just get involved.
And this is certainly not a political show, nor is this a political question, but as you see needs at the VA increasing, are there any initiatives right now that the public, as voters, as civilians, can reach out to our Congress people that can be supportive of vets? Are there any initiatives in play right now that we can be supportive in that endeavor?
I'm not sure about specific initiatives, but writing Congress to let them know how important the VA is and how we have, we really use the cutting edge research and outcome measures to use the best treatments that we can. We have so much to offer the veterans, and so to let the Congress know how important the VA system is, I think a lot of times there's negative publicity about the VA, and it's really unfortunate because I think that there's so many positive things that the VA does that go unrecognized. And so I think that if they can make their voice heard, to say how important, this is the largest healthcare system in the world, and it's like that for a reason. We deal with specific issues that, some other places may not be equipped to deal with, and we are. So I think as much as they can be supportive of the VA, and we really do our best to address any problems that the veterans feel as part of the system. And I just, I think a lot of times those positive stories don't get recognized or don't get as heard as they should be.
Well, anybody in this field can attest it's usually the negative stories that lead, because it's a difficult field to be in, and we're always trying to emphasize the positive. And hearing the positive stories coming out of the VA, not only it's encouraging but inspiring to the rest of the community. So as we wrap today, Dr. Rothman, I can't thank you enough for the work that you are doing. But more importantly, I can't thank our vets enough for the service they provide. So wonderful for you to join us again. I hope we get to do this again.
Yes, thank you. Thank you for having me, and thank you for helping us get our message out there.
We will make sure we do that. This is a good mission for our entire community. So we look forward to getting you involved and being part of that. So thank you again, and thank you everybody for watching today.
Thank you.